Okay, it seems to slow down a bit. So welcome everybody to this webinar entitled Collaborating with Municipalities, a Practical Point of View. My name is Florence Morestin. I'm a scientific advisor at the National Collaborating Center for Healthy Public Policy. And our guest today is Jason Weppler, who is the manager of chronic disease and injury prevention at Grey Bruce Health Unit. Hi, Jason. And we also have my colleague Val Morrison with us. Val will facilitate the Q&A periods, and registered under the name NCCHPP is my colleague Mylène Maguire. She will help you if you experience technical issues. So a bit of housekeeping for a start. Please use the Q&A box if you have either technical issues or to ask your questions to the presenters. And for everything else, you can use the chat box to share your experiences, comments, resources, etc. And don't forget to select Send to Everyone. This webinar will be recorded, including the chat and Q&A boxes, so please keep this in mind. And the recording will be made available on the NCCHPP's website. The evaluation form will be shared at the end of the webinar, so you can answer it live. And if you can't at the time, well, it will be sent by email later to you. So a word about the NCCHPP. We are one of 6 national collaborating centers funded by the Public Health Agency of Canada, each working on a specific topic. And our mandate at the NCCHPP is to support public health actors in their efforts to develop and promote healthy public policies. We are based in Montreal, so I'd like to acknowledge on behalf of my team that we are on an age-old Indigenous territory, a place of meeting and diplomacy between peoples and the site of the signing of the Great Peace Treaty. And we thank the Kanien'kehá:ka Nation for their hospitality on this unceded territory. On a side note, we borrowed this statement from the city of Montreal. It's theirs, and we use it with their permission. So it's anecdotal, but it's really in line with our topic today, which is collaborations with municipalities. So you see a bunch of images on this slide, and they probably bring to mind public health actions. They do. But municipalities also act in all of these areas, either because they implement programs, they install and maintain infrastructure, in some cases because they enforce bylaws. So collaboration with municipalities is desirable and in some cases even necessary. And this has certainly proven to be true for the local response to the COVID-19 pandemic and then to support recovery. Consider, for instance, how solutions were found for accommodating persons experiencing homelessness when shelters had to reduce their capacity. Consider the safe reopening of parks and community gardens. The conversion of some streets into pedestrian zones to allow physical distancing, the authorization of temporary patios, additional picnic tables that were installed in order to maintain social spaces while respecting public health measures. So again, all these required collaborations between public health and the municipal sector. So our aim today is that by the end of this webinar, you are able to describe how municipalities function in general terms, to identify key steps for establishing and maintaining collaborations with municipalities, and to reflect on lessons learned from actual collaborations. Jason will present his experience, and you are very welcome to share your own experience in the chat box in reaction to our presentations. So around 20% of you are not yet familiar with the municipal sector. So let's start with just a 5-minute Municipality 101 crash course. Who works in municipalities? Obviously, there are elected officials, mayors, councillors. It's the persons we think of first, of course, because they are the public face of the municipality. We see them in the media, we see them during elections. But each municipality also relies on an administration made up of public servants. The administration is structured into departments, such as, for instance, the planning department, public works, the economic development department, parks and recreation, the municipal police, etc. The number of departments can vary from one municipality to another. And the way in which tasks are distributed between them can vary as well. The Chief Administrative Officer is the highest ranking public servant. He or she supervises all municipal departments, and this person is also known in some municipalities under other names, other titles such as city manager, or in French, directeur général or directeur municipal. Now, how do elected officials and public servants share the work? The elected officials make up the municipal council, which chooses policy directions and priorities. The council mandates public servants to look into these priorities, and ultimately it's the council who makes decisions. As for public servants, they develop the policy directions chosen by council and make recommendations to it. They also have considerable power of influence, especially in comparison to public servants working at other levels of government. So it's not uncommon for the municipal administration to take the initiative to, well, in terms of proposing policy directions to council. And then once council has made a decision, it's the administration that implements these actions approved, and then that reports to council on what has been carried out. Another body that exists in most municipalities are committees created by council to study specific issues. For instance, a municipality may have a planning committee, an active transportation committee, a committee on aging, etc. Committee membership varies from one municipality to another, and sometimes even from one committee to another, but it may include councillors, representatives of external organizations, citizens, and sometimes public servants. And as you can see in this figure, both the administration and committees make recommendations to council. So there needs to be some sort of coordination. Well, this happens because in cases where public servants are not committee members, at least they attend committee meetings where the projects or issues they work on are being discussed. So this is a very broad outline of how a municipality in Canada functions. 70% of you would approach either a small municipality or municipalities of varying sizes. So let's say a few words about small municipalities' features. In many of them, elected officials serve on a part-time basis because they keep their regular jobs while they hold office. Also, there is a smaller team of public servants, and because of that, some departments don't exist. Some departments have several missions. Some have no employees. They are run by just one person. And finally, the chief administrative officer tends to be more involved in the details of file cases and of case files and projects. So now, if you would like me to clarify some of the things I've said so far, please type your questions in the Q&A box, because I just want to make sure that we all have a basic understanding of how the municipal sector works before I go further. So Val, do we have any questions so far?
I don't see any coming up so far. We can wait maybe just a couple of seconds.
Yeah, sure. We can pause just a bit.
Maybe just take the chance while we're waiting to see if we have any questions to remind people that you can continue to ask your questions throughout the presentations. They'll be archived there, and you can vote on the questions that other people pose if it's something that you're interested in as well. And that way we can see what questions are trending, so to speak. But Florence, I see nothing so far. So if you want to continue with your presentation.
Yeah, so as you said, if people still have questions, just type them in the Q&A and we'll answer them later. So in the remainder of my presentation, I'll give an overview of a practical guide we developed at the NCCHPP on how to collaborate with municipalities. Oh, sorry, I moved a bit too fast. I'd like to say that, well, I'll give just a brief overview of the contents, because you can refer to the guide after the webinar. It's really available on the NCCHPP's website. I'd like to make just a caveat that the guide was developed before the pandemic. So the pandemic hasn't fundamentally changed the ways we collaborate, but it may have colored the collaborative context. We may imagine that in some places, municipal actors may be tired of the predominance given to public health over decision-making for 1.5 years. In some other places, on the contrary, municipal actors may have experienced successful collaborations with their public health counterparts. So that would have a positive effect. So try to figure out what the situation is in your local context and take these considerations into account. The practical guide is a synthesis of resources produced by Canadian institutions, a lot of them based in Quebec, because it has been a trending topic in Quebec for the past few years, collaborations with municipalities. And it's also a synthesis of interviews I conducted with municipal public servants. So all these resources express either the viewpoint of elected officials or public servants or public health professionals who have experience collaborating with municipalities. So the advice presented in the guide is really based on the experience of the main interested parties. Each section of the guide addresses a question to ask oneself when one wishes to collaborate with a municipality. So I'll go through all the sections, and for each, I'll give a very high-level overview of its content. The first two questions you should ask yourself is, what action is the municipality taking in your field of work? And who should you approach in the municipality? So to be strategic and constructive, you need to do some initial research. And the guide proposes a list of more detailed questions meant to support your search for information. An example, if several municipal departments are involved in relation to your topic of work, which is often the case, how do they share the work? And a related question, an important one, are they pursuing the same objectives? Because it's the objectives of different departments can be quite divergent. Let's say that you are approaching the municipality to propose a project aimed at reducing the harms associated with drug use. It is likely that the social development department of the municipality shares your harm reduction objective, but the municipal police may be primarily concerned with maintaining law and order on this issue. Although it must be said that the positions of police forces in Canada have evolved since the opioid crisis began. The guide then proposes a list of leads for information. One example among many, but I think it's a really helpful one. A good advice is to always check the agenda of council meetings and committee meetings. And when an item in the agenda is relevant to you, well, you should review the minutes for that meeting. So it might seem tedious, but it's really a goldmine to keep yourself informed of the municipality's current concerns, to identify the elected officials and public servants who are involved in the subject you are interested in, and to identify well in advance the subjects that council is asking public servants to study, because that's the right time to intervene if you want to influence public policy development. You really need to intervene early in the process, because even when there's a public consultation, for instance, often the main parameters of a project are already set. So really, the earlier, the better. In the guide, I highlight a few resources that I found particularly useful to delve into certain topics. This one was developed at Niagara Region Public Health. It's a process and tools to review the minutes of council meetings. It's super simple. It's just about copy pasting the sections that are of interest to you, and then highlighting in different colors the important points in relation to your topic, the names of councillors who spoke about this topic, and the references to official municipal documents, which you can use then to show consistency between your objectives and those of the municipality. Now, let's just get back to the question of who you should approach. A sub-question is who to approach first. Let's say you have discovered that your area of work concerns a councillor sitting on a committee and professionals and managers working in 3 different departments. So the guide reviews the factors that can help you choose who to contact first, the pros and cons of approaching either elected officials or managers or professional level public servants. For those of you who speak French, I'd like to highlight the website of a partnership that involves all the major stakeholders, both from the municipal sector and the public health sector in Quebec, in the province, because the site features really interesting resources. So the video section features short interviews with elected officials or municipal public servants, which I find really interesting because you get to hear them in their own words, and you also get to simply see them as people, and it makes things a bit less intimidating later on when you want to cold call these persons. The blog section outlines healthy initiatives undertaken by municipalities in partnership with other organizations. So it can be a source of concrete, inspiring ideas. And unfortunately, I don't know of any similar website elsewhere in Canada. But if you do, I invite you to share the information in the chat box. I'm sure many people in the room would be interested, myself included. The next two sections in the guide actually focus on our own organizations. First, what do you know about existing contacts between your organization and the municipality? It's an opportunity to learn from the experience of your colleagues and to coordinate with them. The reality is we often lack this coordination. And it's a problem because currently everybody sees the need to work with municipalities and they are over-solicited. And at worst, uncoordinated public health messages might even seem contradictory to our contacts. So it's really a missed opportunity. In section D, the guide identifies situations in which it is relevant to involve managers or decision makers from either your organization and or the municipality versus having just informal contacts between professionals. The next section addresses a major point. How do you formulate your message to be heard? A common error that many of us have made is assuming that health is the priority of our contacts, or we will convince them that it should be their priority, or that they conceive of a certain problem in the same way as we do. And indeed, a difficulty that many of you expressed when registering for this webinar is that the municipal sector does not see itself as having a role to play in your field of work. So it's up to you to show how what you propose is consistent with the priorities and objectives of the municipality. So the guide highlights general priorities of municipalities. An obvious one right now is post-COVID recovery. One that has been there for several years and unfortunately it isn't likely to change is adaptation to climate change. More generally, if you are able to show how what you propose will offer a response to citizens' demands, that's a very good argument to municipal actors, especially elected officials. Of course, your search for information about what your municipality is doing will provide you with more specific information about its priorities. Secondly, the guide provides a list of what municipal actors usually expect from public health, the value they see in it. A caveat again, this section is based on resources that were produced before the pandemic. So there might be slight changes there, but some of the things won't change. An example is that public health organizations are known to have detailed knowledge of realities on their territory because they collect health and social data through their regular surveillance activities, and more informally because frontline public health workers know very well the populations they serve. And that is very useful knowledge for municipal actors. So if you offer to share this knowledge with them, it can really open doors. Lastly, the guide lists some types of information that are particularly valued by municipal actors. One thing that's very important for them is to know what other comparable municipalities are doing. So if you are proposing a new intervention, it's a good idea to provide examples of other municipalities where this type of intervention already exists. The issue here is that the most researched interventions are those implemented in big cities. So this does not provide useful insights for smaller settings. Hence, the value of this guide, which describes healthy initiatives undertaken in rural municipalities in Ontario. So if you are approaching rural municipalities, you may find here relevant examples from comparable settings. And by the way, Jason contributed to developing this guide, so he can certainly tell you more if you have questions about it. I'll go quickly on the last sections. There's one devoted to how to concretely initiate contact. You have to choose the right moment, of course. Some are recurring and predictable, such as planning of the municipal budget, municipal elections. Other moments are to be seized when they arise. So again, very useful to check meeting agendas. Ways to contact, there are several of them, but the simpler, the better. So emails, phone calls, and about the attitude to have when you approach actors for the first time. There are several tips in the guide, but the bottom line is really humility. It's to show openness to learning from your municipal contacts rather than acting as like you are the expert. The final sections in the guide address how to foster positive interactions and how to maintain collaboration over time. So again, there are tips on best practices. One example is learning to work at the same pace as your contacts. They often deal with a heavy workload and limited resources. And municipalities also have to abide by their legal obligations, including in terms of decision-making processes. So several of you mentioned that their municipal contacts lag time or are slow. And it isn't something we can change, but it's something we can take it into account and plan for. The issue of time is very relevant because collaboration does not happen all at once and it must be continually fostered. This will be evident from the timeline that Jason will present later. And with time, it's also necessary to deal with the challenges posed by turnover, especially among elected officials, but also to a lesser extent among public servants. Hence, the benefit of formalizing the collaboration. One example is by requesting a seat for your organization on a committee of council. To conclude, you'll find in the guide tips on how to approach not just one, but several municipalities at once. So avenues you can use to inform yourself or to communicate with various municipal actors. So there you have it, an overview of the contents of the guide. It was just a glimpse really of the content. As I said, you can refer to the guide after the webinar. And I'd like to conclude my presentation with a short survey just to check where you're at. So Mylène, if you can launch the poll. Yeah. The question is, what do you find most difficult to accomplish? Is it finding out what the municipality is doing, knowing who to approach, coordinating within your organization, identifying who in your organization should be involved, formulating your message, initiating contact, fostering positive interactions, maintaining collaboration over time, or approaching several municipalities? It's a single choice question. It's likely that you experience several difficulties, but I like to single out what's the most difficult for you. So we can wait a few seconds. And by the way, if you have no experience yet collaborating with municipalities, you can answer based on what you've heard so far in this webinar. So let's give a bit more time to let people select their answer. Okay. Milan, you see how things are going. So whenever you think we can close the poll, we will display the results. Okay, so I'll try to extend that. Okay, interestingly, maintaining collaboration over time is the most selected issue. I think Jason can speak to that in his presentation. And knowing who to approach comes second. But really, as we see, and it's not surprising, your answers are split between all of these issues. So Jason will delve into many of these, and we can certainly get back to this in the Q&A period at the end. So Jason, I'll stop sharing and hand it over to you.
Is my screen showing there?
Yes.
Perfect, thank you. So first of all, thank you to Florence for that presentation. I really wish that in Grey Bruce we would have had that guide many years ago. That would have certainly helped expedite our work instead of a trial and error model. We would have had some clear direction. So thank you to that. As Florence mentioned at the outset, my name is Jason Weppler. I work at the Grey Bruce Health Unit in Owen Sound, Ontario. I am the Public Health Manager currently for the Chronic Disease and Injury Prevention team. But the first 12 years of my career, I worked on the built environment portfolio and helped lead our municipal alignment strategy. So I'm certainly excited to talk to everyone for two primary reasons, I guess. One is because I firmly believe in the value of connecting with municipalities in helping develop and design healthy communities, but also because this webinar has been more than 2 years in the making, I guess. I know we started discussions back in 2019, had planned a webinar for March of 2020, and then of course, we're derailed by the pandemic. So very happy to finally be back here with everyone today. Before I go any further, I would also like to acknowledge that I'm on the traditional territories of the Anishinaabe peoples, and I wish to recognize the long history of the First Nations and Métis people on this land and show respect for them today, in particular the neighboring communities of the Chippewas of Saugeen First Nations and the Chippewas of Nawas First Nation. So in terms of an agenda for today's discussion, will be providing just a brief overview of our communities in Grey and Bruce counties. I'll be highlighting some key messages that I'll have you think about throughout the presentation. I'll be speaking a fair amount on specific aspects of our municipal alignment strategy here in Grey Bruce. And I'll conclude with a few recommendations for everyone to take away. And then, as Florence has mentioned, there will be time for some questions and discussion at the end. I will highlight my one primary goal today is just to be able to offer a variety of strategies that everyone can consider today. And even if you're able to take away one or two of those ideas and move towards implementation, I think this presentation from my perspective will be a success. So in terms of our area and region here in Grey Bruce, we have a two-tiered government system. So we have two counties. Those are the regional governments, Grey and Bruce. And within those two counties, we have a total of 17 lower tier municipalities. So there are 9 lower tier municipalities in Grey County and 8 in Bruce County. In this type of a government model, upper tier municipalities often coordinate service delivery between the municipalities or provide regional services across the board. That being said, every area functions a little bit differently. So just a word of caution to take a look at the legislation for your area just to determine what the structure looks like. And I saw a question in the chat about those public health units who fall within the municipal structure. So we can certainly speak to that towards the end. In terms of Grey Bruce as a whole, as Florence mentioned in her in her practical toolkit. We would be considered a smaller municipality. So our largest urban center is only 25,000 people, and the remainder of our areas are small towns, villages, and dispersed populations. We're approximately 2 hours northwest of Toronto on the shores of Lake Huron and Georgian Bay. In terms of health, we have a strong sense of social cohesion in Grey Bruce. So most people feel they can rely on neighbors, friends, family in times of need. But we aren't without our health concerns as well. So we do have high rates of alcohol consumption, those that fall beyond the low risk alcohol drinking guidelines. We also have high rates of physical inactivity and obesity, which is often equated to our car culture here in Grey Bruce. Large rural nature makes cars imperative. So that is certainly a challenge. And then additionally, we do have high rates of falls across all ages of the lifespan. And certainly alcohol and physical activity contribute to that as well. So in terms of key messages to think about at the outset, I think you want to think beyond the health sector. So think about health in all policies. So it can certainly be easier to start with health partners who have very similar mandates. But I think to be most effective, challenge yourself to connect with partners beyond the health sector. With limited financial and human resources, I think it's all imperative that we collaborate for best outcomes. Invest time to develop relationships. Our current partnerships have been 15 years in the making, and certainly they weren't easy at the outset, but I think the time we invested to learn about our municipalities, make those connections, and maintain our relationships have paid dividends over the years. Ensure impact at all levels. In particular, I'm just going to highlight engagement with residents. Public health brings a strong community engagement skill set to the table, which I think is a benefit to many of our municipal partners. So decision makers, we know, certainly appreciate feedback from their residents, and residents need to take an active role in shaping their community. And I think public health can play an intermediary role in that regard. In Grey Bruce, we've been fortunate to work closely with the Tamarack Institute on a number of projects, and they're a national leader in community engagement work. Finally, build consensus for shared action. So without a common direction and an investment in working towards a healthier community, it's often easy to lose focus on that ultimate goal. So I really encourage you to keep a pulse on the current projects happening in your communities, and take those opportunities to strike up a conversation. So knowing when your municipality may be undertaking an official plan review, developing a transportation master plan, or launching a climate change action group, these all set the stage to engage in conversation and work collaboratively. And as we found in time, hopefully you'll begin to see that you no longer need to approach your municipalities on some of these topics, that they will begin to reach out to you where health is a consideration. So just very briefly, our municipal alignment work began around 2005. At this time, our Director of Health Promotion and our Director of Health Protection really both felt there would be value in reaching out to municipal partners and begin to develop that collaboration. It really began as a way to address emergency preparedness. And those initial conversations occurred with the city manager in Owen Sound, our largest center in this region. So hopefully, in speaking about emergency preparedness, this current pandemic maybe has opened up some opportunities again to discuss possible collaboration with your municipalities. So I'm going to, over the next few slides, just touch base on some of these strategies directly, and hopefully these will provide some ideas that you can consider moving forward with your municipal partners. So one of our first strategies was to launch a project called Operation Safe, Strong, and Clean. This was around 2007. And this project saw the health unit immerse a health promoter at City Hall at Owen Sound 3 days a week. And they were working directly with the Community Services Department at the city. So, and this was really a result of numerous conversations between the health unit and the city, and we were able to move forward with that. So the city provided a desk, a phone, and the space for that health promoter to be working, and it provided a lot of opportunities. So it was an opportunity to develop a mutual vision for healthy community development, which was ultimately immersed into the city's official plan. We were able to look at sharing organizational documents and get an understanding of each other's organizations and decision-making structure. It was an opportunity to hold regular meetings with city staff and also have spontaneous interactions with a variety of staff and departments as we were in that facility. And it was also the launch of our input into land use planning proposals. So as the city would receive development proposals from builders, that's was the beginning of our inclusion in those circulations to be able to provide input from a health perspective on those development proposals. And as you can see by a few of the pictures in the corner there, these are some of the projects we worked on. So looking at blue flag beaches, we were part of the active transportation master plan, looking at smoke-free bylaws and community gardens as well. So moving to a different level, in the around 2006, the Ministry of Health Promotion in Ontario required each municipality to have a physical activity plan to be able to apply for funding from the ministry. So in Grey Bruce, rather than all 17 of our municipalities applying for separate funding, we decided to come together as a collaboration and be able to supply as a regional entity for that funding. So this is a strategy that pulled together frontline recreation facility staff. The health unit provided regional coordination to this strategy. And from that, we were able to build and apply for funding, not only to support physical activity across the region, but as you can see on the slide, we were able to expand the partnership and relationship with our municipal and recreation partners to focus on concussion policies, municipal alcohol policies, and age-friendly communities, to name a few. Moving into 2010 was the first of our many Healthy Communities conferences. So this was an opportunity to raise awareness and engage our municipal partners, right from frontline staff to elected officials, in the importance of building partnerships and awareness to encourage healthy communities. So in 2010, we held our first conference, and we have subsequently hosted biannual conferences locally on topics such as community engagement, leadership, collaborative partnerships, and health equity. We've also worked to develop a number of resources that we can share with our municipal partners, again, to help educate and raise awareness. So one of our early resources was Municipalities and Counties Influencing Health. And this was a resource for municipal staff and elected officials. So this was just a simple 4-page document outlining the advantages of municipal alignment between public health and municipal and county partners, and then outlined a number of areas that could be considered for partnership moving forward. So this was a resource that we disseminated to all municipalities, and each 4-year cycle, when there's a local municipal election, this was also used as an education tool for those newly elected officials coming into office. Another opportunity for consideration in terms of educating municipal elected officials and staff are to consider a formal process through municipal council deputations. So this is something we attempt to do every couple years. We ask for a presentation time and a venue in front of our elected officials where we have typically 10 or 15 minutes to profile our topic and a question and answer period as well. So just a couple tips on this. I would recommend, if this is something you're looking at doing, try and book these well in advance, because municipal agendas do fill up quickly. So we try and book these several months in advance. And again, you'll be limited to 10 or 15 minutes of presentation time. So really cater your presentation to highlight the most important aspects of what you wish to share. And then we're often presented with some questions as well. And again, this starts a dialogue at that level as well, that hopefully will transform and progress down to the staff level and lead to joint and collaborative projects. So while our initial Operation Safe, Strong, Clean focused on our collaboration with our lower tier municipalities, since about 2011, we've also been meeting with our upper tier or county partners. So as part of that, we did develop an alignment report, but one of our big projects that we were involved with, multiple staff were involved in it, was Grey County's official plan review, which they entitled Recolor Grey. So public health staff worked closely with the planning department at the county and other departments to ensure that health and all policy language was included throughout the various themes of the plan. And Grey County had 5 themes that they included. So natural gray, move gray, live gray, cultivate gray, and develop gray. And by the end of that plan, there were over 70 policy statements that referenced or supported health and all policies. And that's been a really strong partnership. And as we all know, I think official plans certainly set the stage for healthy community development. Just to touch on a few other initiatives that we've partnered with at the county level, we have sat on the county's transportation master plan as a technical advisory steering committee member. We've hosted joint workshops on active transportation and other topics. We've worked on the development of smoke-free outdoor spaces, collaborated on the local food charter, and both organizations have membership on our housing task force as well. So at this time, I'm going to take a breath and we're going to put another poll up for feedback from the group. So we are asking, what level do you currently feel most comfortable approaching within your municipality? So as Florence profiled, there are multiple levels you can approach, right from elected officials down to frontline staff. Or maybe you fall better into one of the last options here. You're not comfortable, have no experience, or maybe your response varies depending on the municipality. So we'll just take a few moments here to give everyone a chance to respond to that. And then Mylene, whenever you think we have a good response, I'll have you share the results. Thank you. Well, very happy to see that no one indicated they weren't comfortable approaching their municipality. So again, various responses here across the board, but 30% varying depending on the municipality, which is very fair for sure. And then a split between frontline staff or a manager, director, or CAO level. Wonderful, thank you. Oh, and now I've lost my ability to forward my slides. Oh, there we go. Perfect. All right. So just building on the early successes here. So over the last 8 years, we've continued to build on those early successes in Grey Bruce. So I'm just going to touch again briefly on a couple of these and making sure we do have some time for questions here at the end. So one of our strategies in the latter half of this past decade was looking at a municipal alignment strategy. So every 4 years there is a local municipal election held, and we felt that would be a great venue to educate and inform not only our candidates, but those voters as well on the importance of health as part of the municipal election policy. So we've developed resources for our elections in 2014 and 2018, which highlighted health and all policies and the importance of those elected officials, including these topics as part of their election platform. We were hearing from our elected constituents, those who are voting, that health was certainly a priority. So we encouraged elected officials to put these into their into their campaigns. We focused on some of the social determinants of health as those key priorities, which you'll see on the screen. And that's the same for our 2018 election as well, which you can see the document here. In 2018, we took more of a focus on adapting a tool from a neighboring county, Huron County, which policymakers could use as a tool to rate the implications of their decision-making in municipal office against the health of their community. So those are two tools we used over the past last two elections, and I anticipate we will do that again in the fall of 2022 with the next upcoming election. Certainly important to educate those elected officials because, as was referenced in the first part of the presentation, they are the face and decision makers ultimately of a municipality. In 2016 and 2018, we also moved towards developing municipal outcome reports. As we began to develop and maintain our relationships with our municipal partners, we wanted to highlight some of the successful outcomes we had in our joint collaborative work. So this was a two-page document that we shared with each municipality, highlighting some of the outcomes, everything from the number of public health clinics and services provided in an area to joint projects that were worked on with successful outcomes. All right, poll question number 2, Mylene, I'll have you put this up. So how has the global pandemic affected your municipal relationship? And as Florence has mentioned, certainly the pandemic has had an impact. It could have been positive, it could have been negative. So we'd like to hear from you which way you feel that has leaned. Has it enhanced your relationships with your municipal partners, diminished them? Maybe there was no energy, time, or you had different points of view. Have you felt they've remained the same, or you don't feel you have those relationships developed yet? And whenever you're ready, Mylene, if we have a good response, we'll put the results up. All right, so the majority, over 50%, are saying the pandemic has diminished their municipal relationships, and 24% have enhanced, 16% have remained the same. I'd be curious just in the chat if anyone's willing to share how that has diminished. Has it been lack of staff time and resources, or is it divergent points of view? That would be nice to hear. All right, and I think I just have a couple slides left, and then we will be able to open the floor for questions. So certainly, as the poll question has referenced, no presentation in 2021 would be complete without touching on the pandemic. For us in Grey Bruce, the pandemic has really supported and enhanced our municipal relationships. Throughout the course of the pandemic, we regularly offered vaccine clinics at municipal sites across the 2 counties. And this included all 17 municipalities that we had been working with prior to the pandemic. And this was not a simple ask of staff at time and facility resources. These were long-term commitments. As you can see, we were boring community halls, gymnasiums, community centers, and ice rinks to be able to host these vaccine clinics. And our municipal partners were more than willing to step to the plate and offer these facilities. And even when these facilities were beginning to open up, we continued to host these clinics. So there was certainly potential loss of revenue for these municipalities in terms of not being able to use these spaces. So very thankful here in Grey Bruce that we were able to have those partnerships with municipal partners and enhance those relationships throughout the pandemic. To build on that, while municipal offices were closed, many of our municipal and county staff partners even came and volunteered at these clinics in a variety of capacities. So we were very fortunate to have that, and I don't think that would have occurred without the relationships that we had developed pre-pandemic. So my final slide, just some recommendations that I hope you can take away based on the sharings that I've imparted today. Just touch on a few. So one recommendation is really to take the time to commit to understanding, engaging the level of readiness with your municipality prior to launching into discussions. Look at some of the council meeting minutes, visit their website, see what's happening, get a good sense of what's going on before you embark in conversations with your municipality. Try and reach out to those staff you already know. I think that was reflected in the poll question. I don't really think it matters at what level you begin to approach your municipality, whether it be frontline, whether it be manager, director, CAO, or an elected official. I think go based on whatever you feel you have the most comfortable and the strongest relationship with. I think as an organization, consider the methodical investment of time. We were fortunate here to be able to dedicate staff time across multiple programs to connect with our municipal partners. And I think that's paid big dividends in the end. And I would say rely very much on your boards of health, your senior management within your organizations. For us, our Board of Health certainly plays a strong role. They're able to take the information shared at board meetings back to their municipalities and filter that down through their management staff and their frontline staff. So they can really be a strong advocate for the health of their community. And certainly rely on directors within public health, your MOH, et cetera, because they're the regular point of contact with those elected officials and the Board of Health as well. So I think I will end there. Here's my contact information. If you have questions after the webinar, I'd be happy to chat via email or phone. And I will stop sharing my screen and turn it back over to Florence.
Thanks a lot, Jason. So we'll actually open the floor for questions. So Val, do you want to facilitate? I think some questions have been asked in the Q&A box. I've seen some questions in the chat. I'll just ask the persons who asked these questions, if possible, please copy and paste in the Q&A box. It's easier for us to manage.
Yeah, thanks, Florence. I was going to say the same thing. One thing that's come up repeatedly in the chat is the request for links. So I think everything that is happening in this webinar, the links will be available and the webinar will be recorded and links available there. But to those who are joining and suggesting really interesting documents and projects that they're aware of, if you can, please include the links to documents or website if you have those to share with others. So please do that, and thanks for doing that. There are a couple of questions. The first one is maybe for both of you, but I think it was brought up in Jason's presentation, a really interesting one, and I think something that's challenging for some public health, but certainly in our work at the NCC. And that is, how do you identify the trending health concerns for smaller rural areas? Do you lump them all together, for example, so that you avoid identifying factors and identify the health concerns across a larger region? Or do you actually have the specific data for these kind of micro areas?
Yeah, so I can start. That is definitely a true challenge. I would concur with that. I know in Grey Bruce, we really struggle to find local municipal level data. Most of our data comes at the Grey Bruce regional level through the Canadian Community Health Survey, typically is probably our one primary source. So it is very difficult to differentiate between the data at the lower tier level. So typically we do tend to lump our data regionally, and honestly, in our region at least, I feel that the health issues that we see are fairly consistent across the board amongst all our lower tier municipalities and our regional entities. So I think that approach has worked for us to date. You're still on mute, Val.
Thanks. You'd think I'd have figured that out by now. Florence, did you want to add anything there in terms of preparing the guide? Did you see anything specific about smaller or rural municipalities?
No, not in terms of managing data, so I cannot add to that.
Okay. There's a second question that maybe I'll start here with Florence in terms of what you came across in your work, and perhaps Jason will have some specific examples, but what's the role of evaluation, or how do you build in evaluation in a general way in terms of partnering with municipalities? And then Jason, maybe add on at the end if you have some specific things to share about how you at Grey Bruce evaluated your Healthy Communities project.
Yeah, probably Jason will have more practical examples that I do, but a piece of advice I've come across is to try to disaggregate things. And I mean, even of projects, try to have smaller projects, activities that you can evaluate. Maybe it's a big word. Maybe we're not talking about evaluation research, but I'd still monitor the progresses. And the idea of having smaller activities is that it helps slowly build trust among partners. And it's important for both at the level of the organizations involved in the partnership and at the level of the individuals involved to highlight these successes, and it fosters the collaboration. And their higher management has a role to play in publicly recognizing what has been achieved by their staff in the collaboration.
Yeah, and
Jason,
I can just,
did you want to add?
Yeah, I would just add, I think most public health units in Ontario are fortunate to have program evaluators on their staff. So that's one position that we've tapped into. A lot of our outcomes are kind of progress indicators, I suppose, in terms of tracking number of meetings, collaborations, those types of things. We've certainly also tracking, as I mentioned earlier, in terms of like some of the guiding documents that municipalities would have in terms of official plans or master plans. We're trying to track whenever we're able to influence those documents and any language or outcomes that are indicated in there that we've been able to play a role in. So those would probably be a couple of the primary ones. Evaluation is always a challenging aspect of this work.
Okay, there are a few more that I'll come back to in a minute, but an interesting one here that I don't know how often this is the case across Canada, but one listener asked, how do interactions with municipalities change when public health units are embedded within municipalities? I assume that means within municipal governments. And she says, for example, Toronto and Hamilton public health units are municipal departments. This may be something you don't have experience with, but certainly in terms of how public health and municipal governments are structured, might affect the way that you would interact.
Yeah, I don't have specific experience, but as was referenced in Ontario, many public health, well, some public health units are embedded right within the municipal structure. So Hamilton, Toronto, I know Chatham, Kent, and others that I'm a little bit more familiar working with in the southwest region of the province are embedded. I think there's probably pros and cons. I think pros, very much like when we embedded a health promoter right in City Hall, that is the natural situation in those public health units that are embedded within their municipality. My understanding is they're in the same buildings. They would have close proximity to their planning, transportation departments, and other municipal colleagues. So I think there could be certainly benefits in ease of access in that regards, but I'm sure there are challenges as well, which maybe the initial poser could share if they're dealing with some of those challenges.
Right, interesting, thanks. I think this one can go to both of you, again, from different levels of answers and experience, but what would you suggest as, pardon me, some strategies to coordinate within your own organizations to align the current evidence with long-term strategic priorities? So you both talked about, for example, the importance of, Jason, you mentioned the importance of quick wins, things that can be done fairly easily, quickly, the importance of investing time to maintain or to build and maintain those relationships. But what about over the long term and aligning those strategic priorities? Is that something that you've come across?
Yeah, I'll just say, I think it needs to be a priority for the organization that you're working with as a whole. I don't think this work can come from one specific department within the public health unit. One of the strategies that we attempted to impart was to look at a public health community team model. So rather than working across programs and being program based, we focused on a community team model where we had an entire team of professionals dedicated to a number of municipalities. So rather than just myself as a health promoter being that connect to the municipalities, I was working with a team of nurses, public health inspectors, dietitians, oral health professionals, etc. And they were that connect to the community. Regardless of what issue arose or what partnership collaborative we tried to move forward, we always had the right public health professional at the table to be able to support that municipal work.
And Florence, is that something that you're able to comment on, that taking that broader view in terms of investing over the long term?
I'm just wondering whether the person who asked this question was talking about long-term strategic priorities of their public health organization or the municipal actors. I'm just thinking in relation to the latter, a very good way, and it's a suggestion made in the guide, but I did not mention it during the presentation, is to subscribe to newsletters, for example, of your provincial municipal association. They usually are issued once a week. There's 5-6 headlines. You can scan that very quickly, and when there's a topic that's relevant somehow to public health, okay, you can read. And it's a good way of you do that on an ongoing basis. So it's much less work as deciding someday, okay, I want to see what our municipal partners are up to right now. It's really a more effective way of doing so, and seeing what's the agenda and it can be the same. You can subscribe to the newsletter or social media of your municipality if you're interested in a specific one. So it's a good way of keeping abreast, I'd say, without effort. And of course, when you have a specific activity or project you want to promote, you'll put more effort into researching, but it's a good long-term way of doing things, and it doesn't take much time. So
that's a great tip. Thanks. Specifically for Jason, it's a question, and I don't think it's facetious, but someone asked how many people were on your team to be able to produce all of this work, which again, I don't think it's meant facetiously, because public health authorities are often overstretched, and sometimes the regions are very large with different, as in your case, 17 different municipalities. So maybe just give us an idea of, how many people are on the team. The team, it sounds like, changes depending on the need, how it's done sort of practically.
Sure. I would say that has evolved over time with ebbs and flows. I would say probably our most successful model, the program would have been overseen by a manager, but we would have had one health promoter per quad of our, so we kind of had a north and south section of our one county, a north and south section of our other county. So each health promoter had 4 or 5 municipalities they were liaisoning with, and they would have had, it wasn't their only responsibility, but it was certainly a large portion of that. So maybe 0.5 FTE. And yeah, they were connecting with those municipalities, doing those council deputations. And then they would have support from that public health community team that surrounded them as well. So those other professionals on the team, but they would have a very small portion of their FTE allotted to that municipal alignment work. But yeah, typically a small team of 4 leading that work with a condensed area of the region.
Val, your mic is off.
Sorry, I got stuck there. Another question is to ask how you convince the councils or council members to invest in projects that show dividends over the long term and not on the more predictable short electoral cycle. So how, in other words, get people invested for more than short-term gains.
Florence, you want to take that one, or do you want me to?
If you want to start, yeah, I'm thinking of something, but maybe you have a more precise answer to that one.
I'm not sure I do have a precise answer. The challenge with elected officials and Board of Health is the turnover, right? We've got a 4-year commitment, and often by the time they get oriented and feel comfortable in that role, it's where you're down to 2.5 or 3 years. So that is certainly a challenge, that inconsistency. I think we're fairly fortunate here that we often have elected officials who do subsequent terms on the board and as an elected official for their municipality. So the turnover isn't maybe as high as other areas, but that certainly presents challenges when you're redoing that training cycle every 4 years.
Right. It's not an easy question for sure, and there's no silver bullet. A piece of advice, it's not really about convincing them, but it's ways to overcome this turnover in terms of political cycles. When there is commitment from council, is to try to formalize that, let's say, in a multi-year action plan to make sure it won't, it won't stop after the next electoral cycle. Another avenue, but again, it's long-term work, but it's in coalition with other organizations from the community to make what you are suggesting a demand from citizens and expectations a significant part of them have towards their municipality, because elected officials are very sensitive to that. So that's, I would say that's coalition work, with local partners. And another thing is working with public servants in the meantime, if they are more responsive than elected officials. I read somewhere, it was a comment from an elected official saying, with a bit of resentment, saying, eventually they'll win, the public servants, because they are here forever. So you can work and prepare the ground. And if the current council is not responsive or open, well, you can still plan for things in the future.
I think that's a good point. While elected officials change potentially every 4 years, most of the staff stay fairly consistent. So if you're not making headway with the council, maybe you approach a different level or different department within that municipal structure.
Mm-hmm. And then at the very least, you've got that relationship built for the next change, the next policy cycle. Exactly. Interesting. We've only got a minute left, but there's an interesting question for you, Jason, about how you specifically use the graphic that you showed us, the public health in Saugeen Shores with all of the different issues. Maybe a sense of what kind of pitch you give to council using that sort of graphic. Is it very detailed, sort of granular graphic? You did mention you need to be strategic and short in your presentations to council. So someone has asked how you use that one, and maybe just we can end before we go to Florence for some closing words on some of your ideas about how that one was used.
Yeah, in terms of those outcome reports, they were mailed directly to each municipality in advance of council deputation. So they were mailed directly to the CAO and the mayor and the clerk, and then a specific request for a deputation. I really just think it's very important to highlight some of the successes. The more the elected officials and the staff can visualize some of the impact that the partnership is having on the health of our community and the health of the residents, I think that's an important step in the process. Just to highlight those wins, whether they be small term, big term, it's just important to profile the successes the partnership is having. So again, yeah, the deputation is short, so it's very high level, but I think it's important to spend that time to profile those successes.
Okay, great. I think it is 3:15, so thanks everyone, and I'll let Florence formally bring the webinar to a close.
Sure. I'll just say that, Jason, there have been repeated requests, questions in the chat about whether we will share the resources that were mentioned. I guess most of these questions were about the ones you presented in your webinar. So I see you've posted a link, but maybe people will be interested, if possible, to see some of the other resources you mentioned.
Yeah, for sure. I did specifically put the one municipal alignment resource in the chat. But if you go to the Grey Bruce Health Unit website under our Healthy Communities section, you'll find all the resources there, in addition to the one that I added.
Okay, perfect.
And otherwise, email me and I'll send you a link directly.
Perfect. So the references of the other resources I mentioned are in this slide. All the presentation, well, our slides and the recording will be posted on the NCCHPP's website. So I'll just, an important point. I guess Mylène has posted the link to the evaluation form in the chat, so please fill the form. We will also send it by email to you, together with the link to the recording and slides. So thanks everyone. Thank you, Jason, for sharing your experience today. Thanks, Val, for facilitating, Mylène for dealing with the technical aspects. And thanks to all participants. It was a lively webinar, so thanks for your questions and contributions. So have a nice day, everyone. Bye-bye.